Joining us is the founder and president of Midtown Atlanta Nephrology, Dr. Frida Fisher. Dr. Fisher, I'm glad you can join us, but I do want to share something with both of you, Dr. Frida and Kelly, that is blowing up the internet right now. The Met Gala is tonight. Nicki Minaj tweeted about how she decided not to go because they want you to get vaccinated for the Met. If I get vaccinated, it won't be for the Met. It'll be once I feel I've done my own research. I'm working on that now. And then she mentions a story about my cousin in Trinidad won't get the vaccine because his friend got it and became impotent. So just pray on it and make sure you're comfortable with your decision, not bullied. I'm not going to get into even everything else that's going on around that. But that strikes me, Dr. Frida, as some of the challenge we're facing right now with people's understanding of what research even means.
Hi, Nayera. Hi, Kelly. I did my own research. I'm so afraid those are going to be famous last words, because what does it really mean when someone who is not in the sciences, who's not medical, when they do their own research? What we need to do is all focus on our lanes and our gifts. I really love Nicki Minaj as an artist, and if I ever needed any advice on being an artist, being an entrepreneur, on fashion, I would certainly go to her. But when it comes to medicine, to public health, we need to rely on the people who have been trained to do the research, and that's physicians and scientists. And so I want people who listen to those influencers who give misinformation about vaccinations, when you listen to them, I want you to compare your situations to their situations. If you're someone who's very wealthy with access, even if you were to come down with COVID-19, the disease, you likely would have the privilege to have access to ICUs, even if they're full. You would be able to be off work for a week, 2 weeks, a month, 5 years, because you have the income. But for those who are following them, if you get infected with COVID-19, can you afford to feed your family if you miss work? We have to think about it. If you do your own research, make sure you're looking at reputable sources. And as far as that impotence piece, the erectile dysfunction, COVID-19, the disease, has been associated with impotence, not the vaccination.
And the bottom line, Dr. Frida, is that this all comes down to more rhetoric, more misinformation that's out there. And, according to the Office of Vaccines Research and Review, Food and Drug Administration, there is a lot to be concerned with. Booster shots are not needed for the general population at this time. What are your thoughts on that? Because that's something that people have been looking at saying, wait a minute, do I have to get this booster shot?
The booster shots. That's been quite a point of confusion and controversy. But here is the deal with the booster shots. Now, as far as patients who are immunocompromised, studies show us that for most of them, just 2 of the messenger RNA vaccinations, for most of them, that did not give them adequate immunity. So for them, the booster is really more of a completion of the immunity they should have had from the 2 doses. Now, for the boosters, which will be given to people who are healthy, or what's being contemplated, that's where we have to really look at more data, which I'm very excited that this Friday, 2 scientists from Israel will present to the FDA all of their data. And the data does seem quite compelling. If you look at Israel, we know that between July 30th and August 22nd, they vaccinated approximately 1 million people over the age of 60. And they did find that there was a significant decrease in the risk of infection and of severe COVID-19 disease in those who received a booster. Again, the FDA and the CDC will need to review the data in completion, but right now it does look like at some point we will need the booster. And so I just want people to stay tuned and pay attention. Meanwhile, we must wear masks, socially distance when possible, even if you've been vaccinated, because this Delta variant is so real.
And you've always told me that it's a matter of life and death. So I appreciate you bringing those insights to us and getting away from the misinformation and putting out the correct information. Hopefully people will research you through a doctor and know that the science does really save lives, and as well as the vaccine and wearing a mask. Thank you so much, Dr. Fisher. Always good to see you.